So I grew up in Crothersville, Missouri. My dad was a doctor here that practiced for many years, so I wanted to continue in that tradition and continue to be able to be where my dad was in the community and give back to the community with urology. Urology is a critical component of health, specifically in the aging. Almost all men and women to some degree have some urologic issues, but the problem is when they go see their primary doctor, they're focused on one thing versus, you don't talk about every problem that you necessarily have, but you do have options available. The OR staff is very good. The equipment that we have in the OR staff is all brand new. It's the same exact equipment that we have in Memphis or any other institution around the country. And pretty much all procedures, except for major operations where they would require hospitalization, such as robotics or laparoscopy, things that I do all the time in Memphis, I can pretty much do almost anything urologic here. As far as as men get older, almost all men have some degree of prostate obstruction. Eurolift is a new procedure that we've been doing for years in Memphis, and around the country people are doing it, but it's a less invasive procedure to treat prostate obstruction. When most men get older, the prostate gets bigger. I always tell people to describe it like a donut hole. The donut hole kind of gets smaller, and a Eurolift just allows it puts sutures within the prostate to pull the prostate open. So it allows men to get off medication, but it also allows them to urinate better. So it's a good non-real invasive procedure. Most people are back to normal within 24 hours. We have the ability to treat kidney stones now. We have a laser here. We're going to have lithotripsy in the near future so that patients that would normally have to travel outside of the Bootheel to go to Memphis or to Cape Girardeau or some other place, we'll have lithotripsy within the hospital. It'll be here at least once a month, maybe more, if the demand meets that. So patients that have kidney stones or any type of obstructive problems, they can be treated. We can treat sexual dysfunction here now through medications, hormone replacement, and even surgical procedures I do here all the time. Prostate cancer is the most common cancer in men. Men need to be screened at age 45, especially if they have a family history of prostate cancer. They need to be getting a PSA yearly. They need to have a digital rectal exam yearly, because prostate cancer, most men are asymptomatic until the disease is spread. So early detection is a key. We have the ability to screen the patients here at the hospital, but we also have the ability to diagnose and even treat prostate cancer. One of the things that I'm going to offer in the near future is advanced prostate cancer care. So some of the things that men get that have prostate cancer, where they would normally have to travel to a bigger institution, we're going to now be able to give them those same drugs here in the Bootheel. We've just got the ability to start giving a drug called Provenge for people with advanced prostate cancer, and some of the newer drugs that we have the ability to give here. Basically, I've just tried to bring back to the community options they would have elsewhere and not have to travel out of the community to get that care.
Hello, my name is Sunil Mungi, and I'm the President and CEO of Pemiscot Memorial Health Systems. Pemiscot Memorial Health System provides a number of services. One of them is urology services. We have a very fine doctor, Dr. David Gubin. He is board certified in urology and takes care of all those patients, those who need that service.